Anaprox Ds, also known as naproxen, is used to relieve pain from various conditions such as headache, muscle aches, tendonitis, dental pain, and menstrual cramps. It also reduces pain, swelling, and joint stiffness caused by arthritis, bursitis, and gout attacks. This medication is known as a nonsteroidal anti-inflammatory drug, NSAID, and works by blocking your body's production of certain natural substances that cause inflammation. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. Remember to always check the ingredients on the label, as the manufacturer may have changed them and products with similar names may contain different ingredients meant for different purposes. Taking the wrong product could harm you. When taking Anaprox Ds, be sure to carefully follow the instructions on the package if it's an over-the-counter product, or the medication guide provided by your pharmacist if it's been prescribed by your doctor. Take the medication by mouth as directed, usually 2 or 3 times a day with a full glass of water. To prevent stomach upset, take it with food, milk, or an antacid. The dosage will depend on your medical condition and response to treatment, and it's important to take it at the lowest effective dose for the shortest possible time to reduce the risk of side effects. If you're using it for arthritis, continue taking it as directed by your doctor. It may take up to 2 weeks to get the full benefit from the drug. If your condition lasts or worsens, or if you think you may have a serious medical problem, seek medical help right away. If you're using it for fever and it worsens or lasts more than 3 days, consult a doctor. If you experience upset stomach, nausea, heartburn, headache, drowsiness, or dizziness, let your doctor or pharmacist know. It's important to monitor your blood pressure regularly while taking this medication, and report any high results to your doctor. Contact your doctor immediately if you notice any serious side effects, such as easy bruising/bleeding, difficulty swallowing, hearing changes, mental/mood changes, signs of kidney problems, unexplained stiff neck, vision changes, symptoms of heart failure, or symptoms of liver damage. If you experience symptoms of a serious allergic reaction, seek medical help right away. And remember, this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. Nonsteroidal anti-inflammatory drugs like Anaprox Ds may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. The risk may be greater in older adults or those with heart disease, high blood pressure, or diabetes. It may also cause serious bleeding from the stomach or intestines, especially in older adults. Stop taking Anaprox Ds and seek medical help if you experience stomach pain, black stools, chest pain, or sudden vision changes. It's important to talk to your doctor or pharmacist about the benefits and risks of taking this drug. Before taking Anaprox Ds, it's important to let your doctor or pharmacist know if you are allergic to it, aspirin, or other NSAIDs. Also, be sure to inform them about any other allergies you may have. This product may contain inactive ingredients that can cause allergic reactions or other problems. Before using this medication, be sure to tell your doctor or pharmacist about your medical history, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus problems. It's also important to let them know about any kidney problems you may have, as they can sometimes occur with the use of NSAID medications like Anaprox Ds. This medication can make you dizzy or drowsy, and alcohol or marijuana can make these effects worse. So, be sure not to drive, use machinery, or do anything that requires alertness until you can do so safely. Also, limit your use of alcohol and avoid smoking while on this medication, as they may increase your risk for stomach bleeding. Anaprox Ds may also make you more sensitive to the sun, so be sure to limit your time in the sun and use sunscreen and protective clothing when outdoors. If you are on a salt-restricted diet, be sure to inform your doctor, as some Anaprox products contain salt. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For women of childbearing age, it's important to talk to your doctor about the benefits and risks of using Anaprox Ds. If you are pregnant or planning to become pregnant, be sure to inform your doctor, as this medication may harm an unborn baby and cause problems with normal labor/delivery. If you are breastfeeding, consult your doctor before continuing to do so while taking this medication. It's important to be aware of potential drug interactions with Anaprox Ds. Certain medications, like aliskiren, ACE inhibitors, and angiotensin II receptor blockers, may interact with Anaprox Ds and increase the risk of serious side effects. It's also important to be cautious when taking other medications that may cause bleeding, like antiplatelet drugs and blood thinners, as they may increase the risk of bleeding when taken with Anaprox Ds. Additionally, be mindful of other medications that contain pain relievers or fever reducers, as they may have similar effects to Anaprox Ds and increase the risk of side effects if taken together. And finally, it's important to inform your doctor and lab personnel about your use of Anaprox Ds, as it may interfere with certain lab tests and cause false results. If someone has taken too much Anaprox Ds and has serious symptoms like passing out or having trouble breathing, it's important to call for help right away. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, extreme drowsiness, and seizures. It's important not to share Anaprox Ds with others. Your doctor may need to do some lab or medical tests while you're taking this medication, so make sure to keep all of your appointments. If you have arthritis, making lifestyle changes like losing weight if needed and doing strengthening and conditioning exercises may help improve your flexibility and joint function. Make sure to consult your doctor for specific instructions. If you're taking Anaprox Ds regularly and you happen to miss a dose, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next one at your regular time. Don't take a double dose to make up for the missed one. Keep Anaprox Ds at room temperature, away from light and moisture, and make sure to store it out of reach of children and pets. When you no longer need it or it's expired, be sure to properly dispose of it and consult with your pharmacist or local waste disposal company. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.